I'm pretty sure that Oklahoma is the allergy capital of the world. So I'm not sure what state you live in, but if you suffer from allergies, we are here to help. So for the adult patients through MeehanMD or pediatrics with Mindset Kids, we now offer slit therapy, also known as allergy drops, for our patients that are suffering allergies. So I'd love for you guys to watch this podcast where I interview Mike, who's the pharmacist with Allergy Choice, and he can tell you all about the immunotherapy, also known as allergy drops. Hello, everyone. It's Cathy Meehan with the Meehan Mission podcast. And today I want to introduce everyone to Mike Ketchel. So Mike is a pharmacist and he works with a company that we have partnered with to provide some allergy therapy and relief treatment. So we're going to talk about those today. But first of all, I want you all to get to know Mike. So Mike, tell us a little bit about who you are and what you do.
My name is Mike Ketchel. I'm the director of pharmacy with Allergy Choices. I opened up the pharmacy 19 years ago now for this company as a adjunct for patients to receive allergy immunotherapy. We specialize strictly in sublingual, under the tongue, or another term, allergy drops. So that's what we deal strictly with that, and that's what we focused on for the last 20 years or so.
Well, that sounds great. So, I live in the state of Oklahoma,
Mhm.
which I want to say is about like the allergy capital of the world. And I know you guys are located up in Wisconsin, but just wanted to let our community know that we do see patients in all 50 states. So, give me a little bit of a background on like allergies around the different states, because isn't there like regional testing that we would want to do for our patients?
Yes, and a lot of if you're doing blood work, a lot of the labs will have primary panels for specific regions of the United States. So it's real easy to get a specific, whether it's a southeast panel or a northwest panel. They're available through the labs. LabCorp is probably one of them that most people will recognize. But yeah, because I mean, trees are different in different areas, grasses are a little different, weeds especially are a little different. So that's why it's good to get a panel from the region that the patient is in.
That sounds good. So now let me just clarify. So if there's a patient in the Oklahoma area, they can actually come into our office where we do a skin test.
Correct.
But then the people that are telemedicine, we would just send them to a LabCorp and then they could do a blood test there at the LabCorp. Now, is there a specific time or a reason why somebody would opt for a blood test over a skin test if they had the option? Is there like for food allergies or anything like that? Is there
Yeah, we
a rule for that?
Yeah, I think from a food allergy standpoint, I think blood testing is a little better. I mean, it's the skin testing for foods is a little tricky, and a lot of times becomes up negative. From an environmental standpoint, like different grasses, trees, weeds, it really doesn't matter whether they're having blood test or skin testing done. They're both fairly equivalent from the standard of reactivity. So I guess it would be some patients are a little needle shy. I mean, so it'd probably be better to do one blood draw than 15 or 20 different pricks on the arm for skin testing. But they're both equivalent from a testing standpoint that we've seen. We haven't seen a lot of differences. If I had to choose one skin test that's probably the most accurate, it's actually intradermal testing, but it's a very complicated testing, and it takes a long time, but that's probably the most accurate. But most people from skin testing, as you know, which you're probably doing, it's the prick testing.
Yes. Yes, the prick testing, which we're having our training on that, so we'll have that down. So a question, if someone is going to do their skin test or a blood test, they need to be off their any type of a prescription medication, right? Or over the counter medications. Does that help? Would that skew results?
Well, skin testing, it can. Blood
Okay.
testing, it does not matter.
Okay.
But with skin testing standpoint, because we're looking for a histamine response, so if you're taking something like an antihistamine, or people that are on, tricyclic antidepressants or
Mhm.
things like Zantac or something like that, those need to be avoided at least 72 hours,
Okay.
3 to 5 days is what
Okay.
the recommended is for if you're doing skin testing to stay away from those products. But from a blood testing standpoint, it does not matter.
Okay. And I'm pretty sure we'll have a list to make sure
Correct.
that if they have any questions, then we'll make sure that you're off these medications for a few days before we do any, especially any skin testing for
Correct.
those.
Correct.
Yeah. So another question I have is, we see both adult patients
Mhm.
and we see pediatric patients.
Mhm.
So is it kind of like a good idea to start early for allergy testing, especially in kiddos?
Yeah.
With
Well,
for like a
actually,
success rate. I mean, what are your thoughts on that?
yeah. Actually, we over the years, there's a lot of studies out there that show that the early intervention with the treatment of allergies can actually help minimize people developing other diseases down the road, especially asthma.
Okay.
Because a lot of times allergies are an initial trigger for asthma to start. So by taking an early intervention, we've seen, that, a lot of patients, they don't develop into anything more severe. And actually then the allergies themselves get taken care of themselves as well.
So, do you have like any experience or data specifically for like young children that have asthma now and then do the immunotherapy for
Yes.
allergies
Yeah,
and
there are some studies out there, but most of them are anecdotal, which
okay.
means they're not a double-blind placebo-controlled study. But they've gone back. There's a clinic here in La Crosse called Allergy Associates of La Crosse. They're the ones who developed the sublingual protocol, and they've been doing it for 60 plus years. So
Okay.
they actually, did some randomized anecdotal looking at patients that had asthma, then treated with sublingual allergy drops, and the allergies and the asthma cleared up.
Oh, that's good
Does
news.
and
Yeah.
is that for everybody? Does it happen to everybody? No. I mean, I think we know with
Yeah.
medicine, nothing works the same for everybody. But the earlier you can start, especially from environmental allergies, because they're the ones that trigger asthma a little more than the food allergies. Food allergies are, I mean, they're difficult with kids, and we do food allergy treatment, as well. Even people that have anaphylaxis.
Okay.
But the caveat with immunotherapy for food allergies that for patients that have anaphylaxis, it's never going to 100%, you know, uh, you know, I don't ever like to use the word cure, but
Right. Yeah.
it's not going to be where they can, if they got a peanut allergy, they can eat a peanut butter sandwich or a handful of peanuts. But what the therapy does do is it prevents an anaphylactic reaction from accidental exposures. So they still have to be careful, but the therapy itself actually helps minimize that anaphylaxis when you have an accidental exposure.
Oh, that's good to know. Well, and that also kind of brings me back to like I think typically people, when they talk about allergies and therapies and they go to an allergist, then they have to be on some sort of a medication for life or they have allergy shots.
Mm-hmm.
So, can you kind of give me a little bit of a background on, and also kind of like the pros and cons of like somebody that's doing allergy shots versus somebody that would do like sublingual therapy?
Sure,
Because to me,
sure.
I'd rather do sublingual therapy any day
Yeah,
of the week than have to get a
yeah,
shot.
yeah. I mean, a
Yeah.
lot of it depends upon the patient's severity and how bad
Mhm.
their symptoms are. there's a lot of patients that are very well controlled with symptom type medicines. They take antihistamines, and they're very well controlled. But there's also patients that are just miserable at certain times of the year. Ragweed is kind of one of your big triggers.
Yeah.
Grass and tree pollens. So in the early spring or late summer, people get just really, they just get horrible. They get sinus infections, and they can't see because their eyes are all plugged up. So that's where where antihistamines and symptom medicines will help, but it doesn't get them over the edge, and that's where immunotherapy comes into play. The allergy shots, that they've been around for 70 plus years. And they're the gold standards for immunotherapy. But sublingual's been going for about, this protocol anyways, about, for 50 years.
I didn't realize that. Okay.
So but the thing is from a sublingual standpoint, we use the same extracts that they use for injection immunotherapy. We just put it into a sublingual formulation. So it's not different from the actual contents of what the patients are getting. It's just the route of administration.
Okay.
And there's multiple studies out there that, and actually there's a nice Cochrane review that looked at, what is injection better than sublingual or vice versa, and they were proven to be equivalent from an efficacy standpoint.
Okay.
Now, again, when we're talking patients, I mean, everybody's different.
Mm-hmm.
Some patients injection will work better than drops, and some patients the drops will work better than injection. It just depends upon the patient, but in essence, they're equivalent. But the nice thing about the allergy drops are the fact that they're safer. Our protocol has never had an anaphylactic reaction with its use, and they can be taken at home. So it's much more convenient.
Okay. So kind of walk me through, let's say we had a patient come in and, or their results have come in, whether it's telemedicine or in office, and we did the testing in office. What can the patient expect after we've gotten the results, and then the physician is going to prescribe them some allergy drops or sublingual, immunotherapy.
Yep.
So then they're going to take drops. How long? What's like typical?
Yeah, it's a minimum of 3 years.
Okay.
So it's and the time frame is the same as injection immunotherapy. It's usually anywhere from 3 to 5 years.
Okay.
So from our protocol standpoint, what we're looking for patients to do is to get to what we term a maintenance dose.
Okay.
And once they're at that maintenance dose, we're looking for them to have a symptom-free 1 year period. And then once they have that, then they can discontinue. That's why it can be anywhere from 3 to 5 years. It depends upon how quickly they get to maintenance, and then how quickly can they have a 1 year symptom-free period. We're trying to create memory in the immune system, as you all know. I mean, myself, I don't have allergies. So when my body's exposed to these different triggers in the environment, my body knows it's not going to harm me, so it doesn't react. But for people with allergies, their bodies actually perceive these different triggers as harmful. Well, what does the body do when it thinks it's going to get harmed? It protects itself. And that's what all these allergic symptoms are, is the body's defense mechanism, thinking it has to protect you when in reality it doesn't have to. So the therapy, whether it's injection or whether it's sublingual, it's teaching the body that these things are not harmful and to not react.
Yeah. So have you kind of seen an increase in allergies over the years since you've been doing this, or more, I don't know, diagnosis, or, what's your take on the whole allergy industry?
Yeah, I think that, I don't know if there's any more per se, but, I think the fact that, more people are aware that there's other therapies out there that actually, can help with what they're going through. Most allergy people, they've had allergies their whole life, and they've just learned to live with it. They don't complain. They just, they take their antihistamines. Yeah, they don't feel the greatest at certain times of the season. But they've been living with it for 30 years, and, they just keep on plugging away. So the fact that there's more and more talk about immunotherapy out there, I think has raised, the interest and people asking questions. Well, maybe there is something more that I could do to help myself. Like anything, I mean, we also live in a, in a pretty quote unquote clean world where we're wiping everything down and cleaning everything. So our bodies are a little more sensitive when they experience something that they've never experienced before. So that's I've always been a hygiene hypothesis person where it's okay if your kid's hands get dirty and they eat a little dirt. I mean,
Yeah.
it's actually exposing them to things that might, will actually help them deter from any having, bad reactions.
Yeah. Well, I kind of agree with that. Now, we live on a farm,
Okay.
and my grandkids are on the farm, and they are barefoot, dirty, rolling with the pigs sometime, literally rolling with the pigs. And I just think, oh, keep doing that. You're just, creating, this great immune system.
Yep.
So, but I do see that. I've seen, parents that don't allow their children to get dirty at all.
Hmm.
And, to me, I always think, maybe we need to expose ourselves to a little bit of germs
Yep.
so, that our body can just build up that immune system. So,
Exactly. Yep.
yeah, I'm glad you think the same.
Yes.
So, and one of the things that we really like to do is encourage people to be scientists of their own health. And, and just kind of like, what are other therapies that are out there? And, and just, we don't believe in a pill for every ill. We really want to get people off their medications. And really, I think one of the things that we really liked about the sublingual immunotherapy was that, you're not going to be on it for the rest of your life. And it's something, just to help build your own immune system and build up that tolerance to your allergens. And then you can be free from that, hopefully. I mean, that's our hope.
That's the
So,
goal.
yeah, that's the goal. That's the goal. So let me ask you, I mean, have you experienced, not you personally, because I know you don't have allergies, but I'm sure you've heard stories of people that, that really this was a great vehicle to rid them of their allergies.
Yes.
Yeah.
I would say weekly we, talk to patients who have said that this has been just life-saving for them. I had,
Mm,
I had one patient who was ended up being symptom-free, and this has been 10 years ago now already. But they want to keep taking the drops, even though they don't have to. But they
okay.
want to because they don't ever want to get back to
Mhm.
feeling the way they did. And now again, and there's always the other side. There's people that we've had that says, well, this didn't work for me, and in medicine, as we all know, nothing works. Everything doesn't work for everybody. But I would say, and this is kind of a subjective comment from what I've talked to with patients over the years. But I would say probably 80 to 85% of the patients that we have done business with and filled their prescriptions, I would say that if they haven't got a complete resolution of symptoms, their symptoms have decreased to the point where they're tolerable without having to take medicine. So, and
Yeah.
that's really the goal. I mean, you don't have to, that they don't have to be taking, their Claritin around every day for the rest of their life, or nose sprays and, those types of things. So that's the nice thing about this therapy is that, yes, it's a process. It's a 3 to 5 year commitment, but then it's going to be life changing,
Right.
after that.
Right. And it's also very affordable too.
Yep.
So, I mean, I think, the other thing is somebody's going to ask, well, like, can I afford this? When actually it is, you all have made it very affordable. And
Hmm.
so, I appreciate all the knowledge that you've given us today. Is there any final thing or something that I missed, that we should know about allergy choice or the sublingual immunotherapy?
No, I think, like I say, there's more and more talk about immunotherapy, and there's different protocols out there. Our protocol is a little bit more on the conservative side. Patient safety first is what we've always believed in.
Oh, good.
So the fact that We've never had any, anaphylactic episodes with our therapy, and it proves, that it's been well tolerated. Most patients really don't see much from a side effect standpoint. Some people do see a little bit of an uptick in their symptoms at the start of therapy. Body's pretty smart; it usually builds a tolerance up to it, a little tingling on the tongue, but otherwise, it's a really well tolerated therapy, and whether it's a 2-year-old or a 60-year-old. Actually, the dosing is the same.
Okay.
So it's not by body weight. It's actually, each, whether it's, like I say, whether it's a child or an adult, they're actually dosed the same.
Okay. Well, I like the fact that you've never had any anaphylactic shock, any episodes like that. It's definitely effective, safety first, and then the affordability on that. So, I think that is absolutely great. And I appreciate your time, Mike. It was so great meeting you today.
Likewise, likewise.
You bet. And I'll be sure to put links down in the description and everything. So if people want to reach out to get more information on the sublingual or allergy drops, then feel free to reach out to us, and have a great day, Mike. It was great talking to you.
You as well. Thank you very much. Thanks for having me.